My name is Savannah, and I am a nursing student, and I am going to present a patient to you. My patient's name is John Doe. John Doe is an 82-year-old Caucasian male. His former job was a small business owner. He has been retired for 22 years and lives at home with his wife. John Doe's vital signs: for blood pressure, it was 130/80, respiratory rate 16, temperature 98.6 degrees Fahrenheit taken orally, heart rate 82 beats per minute, pain 0 out of 10. Patient came into the hospital with the chief complaint of vision impairment and memory difficulties. He noticed his vision changes about 3 months ago, and memory problems started 6 months ago. The severity of his memory deficit is forgetting acute details, such as if he took his medication. The vision changes have made it harder to see at night, and he states his vision is cloudy. Aggravating factors are trying to see in dark lit areas, such as driving at night. Alleviating factors are turning on lights to better focus vision and wearing reading glasses. Patient had cataract removal on right eye and presents with glaucoma and cataract on left eye. The vision problems have acute impact on ADLs. Memory deficit has a big impact on ADLs. Patient states it's hard to remember what he's already done in the day and feels as if he repeats itself. Life is a big coping strategy as she reminds him of daily tasks. He also states having a big supporting family. When asked about his memory, his response is that his memory isn't as good as it used to be, but he still remembers who he is and what he has done. As a child, he had chicken pox, childhood TB, which presents itself with scarring on the lungs, and mumps. He has a history of type 2 diabetes, high blood pressure, and Bell's palsy on both sides of his face. His recent immunizations was a flu shot, shingles vaccine, and pneumonia shot. He has no allergies or drug reactions to medications. Patient had partial neuropathy because of severe kidney stones. He had a partial colostomy because of abscess on the bowel. Patient has cardiac removal surgery on right eye 1 year ago and carpal tunnel surgery on both wrists. Patient is currently on Omeprazole 20 mg twice a day, Lisinopril 15 mg once a day, metformin 850 mg 3 times a day, Glimepiride 4 mg once a day, Semivastin 80 mg once a day at bedtime, aspirin 81 mg once a day, Megared Omega 3 krill oil twice a day, vitamin D 3 times a day, vitamin B12 once a day, eye drops for glaucoma left eye twice a day, Damsoprozole 10 mg once at night, Emetin 10 mg twice a day. Patient stated no recreational drug use or drinking. He used to walk for exercise, and now he gets exercise when doing house chores. Back pain limits ADLs and exercise. He sleeps the recommended 8 hours every night. His diet is composed of fruits and vegetables. His biggest meal of the day is breakfast, and he stays eating at home 5 days a week. He has never smoked. He drinks a coffee at breakfast and a Diet Coke for lunch. Patient uses no safety devices. Patient lives at home with his loving wife. They raised 5 children together and have 12 grandchildren. He states no longer having any stressors, although he was in the Vietnam War. He has no environmental hazards. He used to be a part of the Church of Christ. He went to college and received a teaching certificate, although never taught. He worked at a tool and die shop, which leads him to a later career of a salesperson. He states getting all of his yearly checkups. Patient's mother and father both had old-onset Parkinson's disease. Mother also had Bell's palsy. He has 2 younger brothers that have passed away. One of his younger brothers had leukemia. The other younger brother had uncontrolled diabetes, which later led to cardio problems. Mr. Doe described his health as good for his age. He is happy that he doesn't have to use any help to walk. He states that he does what he wants with no difficulties. His weight and energy are stable. He doesn't get feverish chills or night sweats. No excessive fatigue or interference with usual activities, and no heat or cold intolerance. For the heat review of systems, patient doesn't have headaches, dizziness, vertigo, fainting, or pain. His vision has changed to presbyopia with age. He wears reading glasses. He also had cataracts in both eyes and had his right cataract removed. Mr. Doe presents with glaucoma on his left eye. No eye injuries were stated. His hearing isn't as cute as his wife's, but he states getting his hearing tested. He doesn't experience frequent ear infections. He doesn't have bleeding or discharge from his ears, eyes, nose, and mouth. His last eye exam was 3 months ago. He goes to get his eyes checked every 6 months. His last dental exam was 3 months ago. He states going to the dentist every 6 months. No persistent voice hoarseness or frequent colds. He states having no trouble swallowing. No radiation therapy for his head, neck, or face. No neck pain or tenderness. For the neurologic mental status review of systems, Mr. Doe doesn't have any numbness, tingling, or burning. He has never had a seizure or loss of consciousness. When asked about any memory concerns, patient states, "My memory is not as good, but I still know everything that is going on." He doesn't have insomnia. He has no unsteadiness or loss of balance. No anxiety interferes with his ADLs. He has no speech difficulties. No past history of head injuries except when he was in a car accident once and got hit in the head. Documentation of the heat assessment. Head is midline, round, symmetric, appropriate for body size. No tenderness or deformities. No lesions or scaliness of the scalp. Pigmentation even on face and scalp. Face and head structure symmetric. Smooth range of motion of the neck. Midline trachea, no deviation. No crepitus or tenderness in cervical vertebrae. No tenderness or enlargement of the lymph nodes. Normal eye structure, no abnormalities. No tenderness of the lacrimal apparatus. Visual acuity of 20 out of 200. Normal visual fields. Coordinated and smooth cardinal field movement. Equal reflection in eyes bilaterally. No additional movement on cover test. Pupil constriction concentric and direct bilaterally. No eyelid pertussis. Lack of eye conversion during accommodation test. Normal eye structure, pinnae and tragus firm but movable. Negative Romberg's test, but a little shaking noticed. No structure symmetric and midline, no pain or swelling. Patient sniff present bilaterally. Normal inner nose structure, septum midline, mucosa is dark pink. No pain or tenderness for frontal and maxillary sinus. Lips smooth and pink, no cracking. Smooth range of motion of TMJ. No tenderness and no popping or clicking. Normal mouth structure, some yellowing of the teeth, tonsils graded to 2. Normal hypoglossal cranial nerve function, normal glossopharyngeal and vagus cranial nerve function. Results of the cranial nerve assessment. Patient states no noticeable change in smell. Normal olfactory nerve. Visual acuity, both eyes 20 out of 200, left eye worse than right eye. Normal visual fields. Normal cardinal fields. No accommodation noticed. Normal pupil direct and consensual constriction. No eyelid drooping. Normal light touch sensation of the face. Eyelids closed during corneal reflex. Symmetric movement of the mandible. Normal masseter and temporalis muscle strength. Accurate and equal facial expressions bilaterally. Whisper test revealed that he had some hearing trouble. Normal Weber test. Normal Rhine test. Negative Romberg test. A little shaking during Romberg test. Uvula rose midline and soft palate rose symmetric. No problem swallowing. No voice hoarseness. Equal strength in shoulders and head rotation. Tongue moved equally with ease. Normal hypoglossal nerve. Documentation of the neurological system assessment. Patient scored a 27 out of 30 on the mini mental exam. He forgot the 3 words to remember. He had a normal even gait and started to stumble walking heel to toe. Negative Romberg test. Regular finger to nose motion. Normal examiner finger to nose motion. Normal rhythm and rate for rapid alternating movement. Couldn't assess heel to shin. Good light touch assessment on arms and legs. Good painful sensation on arms and legs. Normal vibratory sensation, normal Sturgeonangus test, normal Gustatia test, normal proprioception of fingers and toes. Negative Babinski test, no signs of ankylosing. When asked about the cardiovascular system, the patient reported no chest pain, no arm or jaw numbness, no history of heart disease, HTN, or murmur, no change in exertion tolerance. Patient states that he is above normal fatigue for his age. When asked how far he could walk without being distressed, patient states not too far because of back pain. He can walk just around the block. He has no difficulty lying flat and uses 2 pillows. He has no heart palpitations. Cardiovascular disease is a high risk for my patient given his type 2 diabetes and hypertension. The article I read states that type 2 diabetes puts the patient at a 2 to 4 times increased risk for cardiovascular complications. With this being said, a cardiovascular assessment should be looked at for my patient. For the gastrointestinal nutrition review of systems, Mr. Doe states he has no frequent indigestion or heartburn. He says he gets heartburn sometimes depending on what he eats. He states no change in bowel habit. His usual bowel pattern is having a bowel movement once a day with no pain. No nausea, vomiting, diarrhea, or constipation. No change in appetite or food tolerance. No jaundice. No history of colon biopsies. I would do an abdominal assessment because my patient presents with diabetes and gastroparesis is associated with diabetes. Gastroparesis is a severe negative effect on gastric function and can cause bloating and vomiting. This can require the patient to be hospitalized so the patient is stable and would impact my patient's quality of life.